Bokma, Saholchafoa Betsy. Hello, my name is Betsy Chickasaw. I am Chickasaw and Choctaw. I'm originally from Marlow, Oklahoma, so the southwestern part of Oklahoma. Born and raised, Okie family for several generations. And I went to school for undergrad in Tulsa at Oral Roberts University. I also did my Master of Public Health and Health Promotion Sciences at the OU Health Sciences Center in Oklahoma City. And currently I live in Aurora, Colorado. I am pursuing my Doctor of Public Health in Community and Behavioral Health. And hopefully through my continued education, I can return to Oklahoma and share the knowledge that I've gained to shape programming and policy for the better. Growing up, I was fortunate to have private insurance through my dad's job. My parents are divorced, but he worked at Goodyear, so we had okay insurance. And it kind of picked up the slack when IHS wasn't covering it. But there was a time he retired early and I lost coverage. And this was before Medicaid expansion. And I had to navigate the healthcare marketplace. I was lucky in that time that I could use the Indian Health Service system and my tribal healthcare. But at the same time, a lot of these Indian Health Service facilities are severely underfunded and severely understaffed. So if I needed to go to an Indian healthcare facility, I often knew that that meant blocking out my entire day because I was going to be there all day waiting. Most of the time, that was how it would go. I also have chronic illness. After this period of not having coverage and having to visit, and I have visited several different Indian health facilities, as I mentioned, like as a college student, that was kind of when I started getting sick. So I went to the Lawton IHS, and then I have also been to the Claremore one. I've been to all the urban Indian clinics. When you don't have health insurance and you're native, you just know that you can get into a tribal clinic and try to get to wherever you can. So that was kind of my experience before I was able to get a marketplace plan. And that was definitely a life-saving moment for me because I was able to access a lot of the providers that I needed to help me with my chronic illness. Sometimes when you have chronic illness, you have to see a lot of weird specialists. So that was kind of my case. And I think the most bothersome chronic illness, I have Hashimoto's, I have endometriosis, and some other question mark undiagnosed things. But endometriosis has been incredibly challenging. I have had it probably since I was 14, which is when I started menstruating. It took me about 11 years to get officially diagnosed. So I started all of this around age 14, was in serious pain. And so nauseated that I was puking and crying. And I had to just try and take over-the-counter nausea meds and go to school and make it work. But I always knew something was wrong. So when I got older, I was like, I'm done, with being sick. This is not working for me. And so I started seeking out more of the specialists that I mentioned and had surgery in June of 2021, and come to find out my appendix was covered in endometrial lesions and partially ruptured. So who knows how long it had been ruptured. That was in that moment when I was like, I'm done. I'm seeing a specialist. This is horrible. So I'm glad that I was able to access that care, because if I hadn't, who knows how the outcome would have changed, because, an appendix rupturing is a pretty acute problem. And I had what is known as chronic appendicitis in addition to stage 1 endometriosis. This procedure probably saved my life because if that had been allowed to go on, I could have gone into septic shock and all of these crazy things. So as a person with chronic illness, it is exhausting having to navigate our healthcare system. It really sucks, especially in the middle of a pandemic, knowing that we're at higher risk for just about everything. So always check in with those friends. And I think too, if you have this knowledge, volunteer somewhere. There's a lot of clinics that would probably love to have someone in that role of patient navigator, or even just, especially nonprofits, they need those volunteers to give their time to help others. And as far as policy goes, I think you can just never stop learning. So always be learning, but also find out who your representatives are, and make sure they know who you are.